Bismillahirrahmanirrahim. Cell Injury and Cell Death, Reversible and Irreversible Cell Death by Dr. Shahid Qureshi. Cell injury defined as variety of stresses as a result of changes in internal and external environment. Cell injury results from disruption of one or more of cellular components that maintain cell viability. Injury at one point induces a cascade of effects. All the cells of body have inbuilt mechanism to deal with changes in environment. This is called cell injury. Etiology of cell injury: non-lethal reversible cell injury and lethal irreversible cell injury. Irreversible cell injury leads toward necrosis and apoptosis. Reversible cell injury leads to cellular response, for example, abnormal storage, hypertrophy, hyperplasia, dysplasia, and neoplasia. Tissue response leads to thrombosis and fibrosis. Mechanism of cell injury: general principles. The cellular response to injurious stimuli depends upon type of injury, its duration, severity. The consequences depends on type, status, adaptability, and genetic makeup of injured cell. Structural and biochemical components of a cell are so integrally connected that multiple secondary effects rapidly occur. Cellular function is lost far before cell death. Mechanism of cell injury: cell membrane damage lead to loss of structural integrity and loss of function. Mitochondrial damage lead to inadequate aerobic respiration. Ribosomal damage lead to altered protein synthesis. Nuclear change lead to abnormal proliferation, decrease ATP production, so plasma membrane energy-dependent sodium pump is reduced, resulting in cell swelling. Increase intracellular calcium, production of oxygen-derived free radicals. This is showing pathogenesis of cell injury: ischemia, mitochondrion, decrease in oxidative phosphorylation, then also decrease in ATP. This will lead to an increase in aerobic glycolysis, decrease in glycogen, increase in lactic acid, and decrease in pH, clumping of nuclear chromatin. Then decrease in sodium pump, increase in influx of calcium or hydrogen and sodium, increase in influx of potassium, and endoplasmic reticulum swelling, cellular swelling, and loss of microvilli or blebs. Then also detachment of ribosomes and decrease in protein synthesis. This is called pathogenesis of cell injury or cell death. Causes of cell injury: hypoxia, oxygen deficiency, and ischemia, blood flow deficiency. Physical injury: mechanical trauma, temperature extremes, burn injury, frostbite, electrical current. Chemical injury: chemicals, toxins, heavy metals, solvents, smoke, pollutants, drugs, gases. Radiation injury: ionizing radiations, gamma rays, X-rays, non-ionizing radiations, microwaves, infrared, laser. Biological agents: bacteria, viruses, and parasites. And number 6 is nutritional injury: malnutrition, protein deficiency, and overnutrition like obesity. These are causes of cellular injury. Morphology of reversible cell injury: in older literature, the term degeneration was commonly used to denote morphology of reversible cell injury. However, since the term does not provide any information on the nature of underlying changes, currently the term retrogressive changes or simply reversible cell injury are applied to non-lethal cell injury. Common example of morphological forms of reversible cell injury are as under: hydropic change, hyaline change, mucoid change, and fatty change, discussed under intracellular accumulations. This is called morphology of reversible cell injury. Morphology of cell injury: irreversible or necrosis. The changes are produced by enzymatic digestion of dead cellular elements, denaturation of proteins, and autolysis by lysosomal enzymes. Cytoplasm: increased eosinophilia. Nucleus: non-specific breakdown of DNA, leading to pyknosis, shrinkage, karyolysis, fading, and karyorexis like fragmentation. This is called morphology of cell injury. Thank you.